Hello, I'm Dr. Robert Ang, and I know that as ophthalmologists, we need to know how our patients see the world. And I'm not just talking about their vision.
Hello, I'm Dr. Pavol Vesely, and today with Dr. Ang, we are going to talk about strategies for understanding refractive surgery from the patient perspective and combining this feedback to choose the right treatment option for optimal outcomes. So Bobby, why is it so important to understand patient demands?
It's important because patients come to us and we need to understand what they want so that we get to answer that and we get a higher patient satisfaction if we address what their needs are. In your experience, what are the key patient demands, Pavol?
Well, it's the visual acuity stability at the first point, then the fast recovery, and I believe these are the two key factors my patients require. They ask me, how fast will I be ready to go back to life? And is it going to be stable, even in 10 years?
Everybody wants to come to our clinic. They hate glasses or contact lens. And I think over the years, what changed is the age group. Because before they were young, and now even the 40 to 60-year-old come to our clinics because even that age group, they want spectacle independent. I know some practices rely on counselors, rely on the optometrist, but I think establishing patient trust involves either shaking of hands, saying hello, saying good morning, and then being there to answer all the questions because they want something, but they're also afraid that something will go wrong. So trust is something that is person to person, face to face. So I think that's very important that we establish this relationship and trust with each patient.
Yeah, you're right, because the more we talk to patients, the less anxiety they have.
Yeah, you notice that they're kind of anxious and then later they will add stories about themselves. Exactly. And you know that, oh, now we've established a connection, now you can go into more medical terms, right? But at the beginning, you can't bombard them with medical terms.
That is right. You need to talk with your patients also about other things but medicine
yeah.
And surgery. I always ask them, like, what are your hobbies and family things.
They always love family things because everybody has good experiences. So I have this patient who came for LASIK screening. When she sits down and she's in front of you, she brings out a notebook and a pen. There's a list of questions in that notebook already. So you know that, oh, this is for the long haul. I think I'm going to be stuck here for 30 minutes. So we have no choice but to answer the patient's questions one by one. But my technique is, first, I already have the screening results. So at that point in time, I check it out. Then I kind of have a plan or strategy for this patient, whether they're qualified or not. And if they're qualified for several procedures, then explaining is the beginning. And then I pause and give her time to ask rather than bombard her. So give her time, ask. Now, these kinds of patients, they will probably go to another clinic and do the same thing and ask a question. And I guess they will come back to whoever is the most patient with them.
Well, it's more or less the same. The thing behind it is, what I realized when the patient actually asks you, what is the surgery like, or whatever in a matter of the treatment, the patient is actually asking, how will I do? You need to lead him through the whole process. Although you would describe the whole process twice, 3 times to the patient, you need to take him through the process so that the patient understands what is going on. Then they relax, and then their anxiety or demandingness is actually deteriorating.
One strategy I also employ is, I don't want to be hard sell. The more she asks, the more I say, okay, you can go to other people and do this procedure wherever you want, right? I'm not the only doctor who does this here. So you get a taste of whatever, and whoever you end up trusting, that's where you go. I mean, the more I feel that the more you kind of want them to have the surgery, the more they hold back. So this strategy is like, you're relaxed, they're relaxed, we don't care. The problem is the next patients are waiting. Why is it so important to educate patients on the individual treatments that you've chosen, right? Because some patients, they kind of have, some are qualified for only one thing, but most are qualified for multiple procedures. So what's your style or approach?
I briefly explain them principles of all procedures available. And I let them to have the first impression, and I let them to say what do they think, what do they like. We need to admit that people don't like pain. PRK is painful at the end of the day. So most of the, especially young people, would go either for Lalax or for the LASIK. And then it's only a matter of communication and explaining what the procedure is going to be into deeper details. Yeah, you need to explain your patient what is going to happen with him. You are gaining trust, and you have a more relaxed patient after all at the end of the day.
Yeah, I think we have to sacrifice our time to explain this ourselves and to also set the expectation for each procedure, because if you leave it to somebody else, I feel that they might overpromise. And medical questions, especially on risk, I think the doctors have to be the one to answer the patient, whether in terms of percentages or what I feel is also important is answering the question of, if something goes wrong, this is what I plan to do. That way, the patient knows that, yes, this doctor has gone through something went wrong and they know what to do next. So that calms the patient down.
What I do, actually, I'm not waiting the patient to ask the adverse event questions. I tell it ahead so that the patient knows that I'm not afraid of talking about complications. And this is also the way how to gain the patient trust. With strategies like this, we can put ourselves behind the eyes of our patients and synergize with them for optimal refractive surgery outcomes. In our next episode, we'll shift our focus from what the patient wants to the treatment options we have at our disposal and share some strategies on how to best deploy them. Don't miss it.